Welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us. Going to be speaking with Dr. Louis Aronne, the Chief Medical Officer of Intellihealth and Medical Director of the Comprehensive Weight Control Center at Weill-Cornell. He's joining us here on the program to talk about the latest medical obesity treatment, Intellihealth's Evolve. Welcome to Health Professional Radio, Dr. Louis Aronne.
Thank you very much, Neil.
As Chief Medical Officer of Intellihealth and Medical Director of the Comprehensive Weight Control Center, give us a brief look into your area of expertise, a little bit of your professional background, and then let's talk about Evolve.
Well, obesity is one of the most serious health issues affecting Americans, and in fact, people around the world. There's been an explosion in obesity, and the way to treat obesity is not well understood. For the past 30 years, we've had a very successful program at Weill-Cornell. We've found new ways to treat the problem that go way beyond the traditional eat less and exercise more. Mm-hmm. Some of our strategies involve many different dietary options, and if those don't work, we have medical options that have been shown to be quite successful. Our program at Weill-Cornell has expanded over the past 9 years from 2 physicians to 9 physicians. Last year, we did over 20,000 visits, mostly by telemedicine. So, we think that we're moving from the era of treating the complications of obesity, diabetes, high blood pressure, high cholesterol, and heart disease, into the era of treating obesity itself.
What percentage of Americans would you say could be considered obese?
It's actually more than 40%. In most of the world, it's at least 30% and as high as 45%. Obesity begins at a weight of about 40 to 45 pounds above ideal body weight. If you look at the average woman in the United States, for example, they're overweight. So the average weight of the average woman, the average man, they're overweight.
Now, when it comes to treating obesity, are we overweight because we're not treating it or because there is really no treatment for it?
Well, many people think there's no treatment. So let's first talk about why this happens. Eating, quote-unquote, fattening food does something to your brain that makes you continue to increase the storage of fat in your body. It's not what people think. People think that you eat too many calories, that if you just cut down on calories, your weight will go down. But something physical happens in your brain that makes you want to continue to have a higher and higher weight. And this is part of a survival mechanism. If we didn't have this, people would have starved to death long ago. And in trying to lose weight, so once you start to gain weight, it's hard to go back. There are physical mechanisms that prevent you from going back. So in our approach, if diet and physical activity of one type or another works, that's great. But if it doesn't, we go beyond and use medical therapies that we've been studying for years, for decades, that we know are safe and effective.
Well, if there are some people who are obese where exercise works, what is happening in their brains that's not happening in the brains of those who those strategies do not work on?
Sure, that's a great question. The short answer is that we think that the resistance mechanism to weight loss is not as powerful in those people as it is in the vast majority of people. So if you did a dietary study, only a third or less of people would lose 5% of their body weight. 2/3 of people would not. So when you think about this as a public health problem, you could reduce weight by 5%, and less than a third of people, you can reduce their risk of developing serious illnesses like diabetes significantly if you can get them to lose that weight. But the majority of people can't get there. And those are the people who we are targeting with a program like Intellihealth Evolve.
I understand, based on what you're saying, that in order to be successful at weight loss, you can't do one thing or the other. I'm supposing that there's a combination of strategies so that both groups of people can benefit.
That's correct. So when in trying to lose, again, we think that everybody who's trying to lose weight needs to be on a good diet. What does that mean? That means more vegetables, more fruits, less fat, less sugar, and less processed food. No sweetened beverages or minimal sweetened beverages. That type of diet has been shown to help people to lose weight. The problem comes, people start to develop cravings, interest in food. They feel hungry. Some people can't fall asleep. Those are the physical things I'm talking about that stop us from losing weight. And what we've learned now is the reason that happens is because of changes in the brain that make it difficult to lose. Our program includes treatments that help to manage those problems and make it easier for people to lose. So somebody who's on a healthy diet will find it easier to lose, and they'll lose more weight with the types of approaches that we have developed.
IntelliHealth Evolve, is this a recently developed technology, or is this something that we're getting the word out about that's been readily available?
We've been working on the Evolve platform for more than 10 years. Mm-hmm. Our program at Weill-Cornell is extremely successful. We have the biggest weight management program that is medically managed and has this comprehensive approach in the country. And the question to us was, how do we expand this across our entire institution? We're part of the New York Presbyterian Hospital Network. We have an enormous healthcare system in the New York area. Mm-hmm. We developed IntelliHealth Evolve to allow physicians in other areas to deliver the kind of care that we deliver, because we can't see all the patients. So physicians in cardiology, patients with heart problems, mm-hmm. patients with fatty liver, patients with cancer have an obesity problem, and the increase in body weight increases their risk of having a recurrence of cancer. So we've developed this program originally to help people in other parts of our own healthcare system, and now we're making it available to physicians everywhere.
How easy is it to integrate this new system into existing platforms at a practice?
For a physician who is practicing in primary care, endocrinology, family medicine, it's very easy to make the shift. Evolve includes all of the tools that you need to manage patients. A lot of people, I've taught many people to use our strategies, and if someone is with us for a long period of time and they have our handouts, all of our materials, they're able to go out and practice. But people who we would lecture to for just one afternoon weren't able to duplicate what we did in their own setting. And so we put Evolve together to include everything that you would need to go back to your office and put the whole thing together. And now we've tested it out. We've seen that it works just as we say. People who use this strategy are able to increase the likelihood that someone will lose 5% of their body weight up to 70%. So from 30% with diet alone, we've increased that number to 70%. And remember that we're talking about using this as part of healthcare. So the patients who we see primarily have health problems associated with their weight, and their care is covered by insurance, because we're treating their diabetes by getting them to lose weight and using weight-losing strategies that are part of their overall management. That's something that physicians haven't done. They would, for example, prescribe medicine for diabetes to control blood sugar. But many of those medicines make the patient gain weight. It's turned out that isn't good for the patient's overall health. So by gaining weight, they get into a vicious cycle of more and more weight gain, and that worsens their diabetes. Using the IntelliHealth Evolve strategies, what we show the physician is how they can prescribe medications that will help the patient to lose weight, and then we give diets and support material and connect them to the patient in a way that will help that patient to lose weight and get their sugar into better control.
Doctor, where can we learn more online about IntelliHealth?
Our website is www.intellihealth.co. You can learn everything you need to know about the IntelliHealth platform.
Great. Great. Well, I appreciate you joining us here on Health Professional Radio. It's been a pleasure speaking with you, hoping that you'll return.
Thanks so much for having me, Neil.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Louis Aronne. He's Chief Medical Officer of Intellihealth. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download it, SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.